Okay, so let's talk about agoraphobia. It's a word we hear, and maybe you picture someone who, avoids big open fields or something.
Right, that's the common image, but it's much deeper than that.
Definitely. We've got some really interesting sources here that dig into the whole picture, where the name even comes from, what it really feels like, potential causes, and importantly, how people get help.
Yeah, and the name itself is fascinating. It traces back to ancient Greece, the agora, those public squares, like in Delos.
The marketplace,
Yeah,
basically.
exactly. And then much later, 1871, a German psychologist, Westphal, coined agoraphobia. So the name points towards public places.
But that's only part of the story.
Precisely. Our sources really stress that. It's just one piece.
So the definition we're working with from these sources is it's an anxiety disorder. You feel intense anxiety in situations where you feel like unsafe or where getting away would be hard,
Yeah, unsafe and trapped, essentially. Think about everyday
like
things.
public transport.
Uh-huh. Or shopping centers, big crowds, waiting in line.
Or even just being outside your own house, alone.
Right. Those kinds of situations become incredibly distressing for someone with agoraphobia.
And it's not just feeling anxious, it's the potential for actual panic attacks in those moments, isn't it?
Absolutely key. And these aren't mild. We're talking about really strong physical reactions, heart pounding, racing,
Sweating, trembling.
nausea, dizziness, feeling like your throat is closing up, can't breathe properly.
Yeah. Intense.
Very. And with that comes this overwhelming fear of dying or, losing control completely emotionally, behaviorally.
Which naturally leads to avoiding those situations. I
Yes.
mean, who wouldn't want to avoid feeling like that?
Exactly. Avoidance is a core feature. People really go out of their way to steer clear of triggers.
And in severe cases, that avoidance can mean, well, basically being unable to leave home.
Yeah, becoming housebound. And the impact on daily life, on relationships, work
Go.
is huge.
Let's look at the numbers briefly. The sources say about 1.7% of adults.
That's a figure, yes. And interestingly, women are affected about twice as often as men.
And the timing. It often shows up in adolescence or early adulthood.
Correct. But also, there's another peak, kind of, in people 65 and older. It's pretty rare in kids, though.
Okay, so our mission here is really to get past that simple fear of open spaces idea and understand the whole condition, all its different sides.
Let's dive back into the symptoms then. That core anxiety in specific situations.
Right, but emphasizing again, it's the feeling unsafe, feeling like there's no easy way out, not just disliking crowds.
Exactly. Those examples, buses, shops, queues, they're places where escape might feel complicated or embarrassing.
And the panic attacks themselves.
Yeah.
You mentioned how intense they are. They come on fast.
Very suddenly, yeah. Usually peak within maybe 10, 15 minutes and then tend to fade over the next half hour or so.
But during that peak,
Mm.
beyond the physical stuff, the fear of death, fear of going crazy,
Or doing something completely out of character. It's terrifying for the person experiencing it.
which leads us to complications, the longer-term effects.
Mm.
The sources mention links with other conditions.
Yes, significant ones. Depression is often comorbid, so are substance use disorders. People might try to self-medicate the anxiety.
Yeah, it makes sense, unfortunately.
And tragically, there's also a link to suicidal ideation. It really highlights how severe this can be.
The sources also noted a couple of related things like temporary separation anxiety.
Yeah, some people with agoraphobia might also feel uneasy when, say, a close family member leaves, and also something called macrophobia,
Which is,
a specific fear of waiting for long periods, particularly outside, little nuances that show the breadth of the anxiety.
okay, let's shift to causes. It sounds like it's usually not just one thing.
Almost never just one thing. The thinking is it's a mixed genetic predisposition meeting environmental factors.
So family history can play a role, like if anxiety disorders run in the family,
Yes, that seems to be a risk factor,
and stressful life events.
like trauma.
Definitely. Things like losing a parent, being attacked, or other major stressors can act as triggers. They shake your sense of safety in the world. Now, this is interesting, the potential link to the vestibular system, our sense of balance.
Right. This is a fascinating area of research. The idea is that some people with agoraphobia might have, let's say, a less reliable internal balance system.
So they rely more on what they see or feel underfoot.
Potentially, yes. More on visual cues or tactile information. So imagine being in a wide open space with few visual markers.
Or a really visually cluttered, busy space.
Or even just walking on uneven ground. For someone relying heavily on those external cues, it could feel disorienting, unstable.
Like the internal compass is a bit off.
Kind of, yeah. And that virtual reality study you mentioned earlier fits with this, suggesting maybe a difficulty processing fast-changing sights and sounds.
Which would make busy environments feel overwhelming.
Exactly.
Okay, what about substance use? That came up too.
Yes, there's a noted link, particularly with the chronic use of certain medications like tranquilizers, benzodiazepines.
Sleeping pills and the like.
Uh-huh. And interestingly, sometimes when people stop taking those, the agoraphobic symptoms can actually decrease.
Really?
In some cases, yes. Alcohol use disorders are also linked. Heavy, long-term alcohol use can mess with brain chemistry in ways that might contribute to panic and agoraphobia.
And tobacco. Smoking.
Yeah, there's an association there too with nicotine dependence. The exact why is less clear. Could be nicotine's effects, could be related to breathing changes from smoking, or maybe people prone to anxiety are just more likely to smoke. It's complex.
Lots of potential factors intertwining. Let's look at some of the psychological theories. Attachment theory.
This theory suggests agoraphobia might stem from an attachment deficit. Basically, a temporary struggle to handle being physically separate from a person or place that feels like a safe base.
Like needing that anchor nearby.
In a way, yes. Then there's spatial theory.
Which connects it to modern life.
Right. It's this idea that, cars, urbanization, they've created these huge public spaces while maybe our private, truly safe spaces have shrunk. This expansion of public space might clash with some people's needs.
That's a really thought-provoking angle. And evolutionary perspectives.
These suggest it might have roots in ancient survival mechanisms, like it was adaptive for early humans to be wary of wide-open, exposed areas where threats could be lurking.
So that fear response could be a kind of echo.
Possibly. And they make a distinction here. Primary agoraphobia, the kind without panic attacks first, might be closer to that evolutionary avoidance, whereas agoraphobia with panic attacks is maybe more of an avoidance learned after having scary panic attacks.
Okay, so that leads into diagnosis. How do doctors figure this out?
Well, a big part of it is understanding the relationship with panic disorder. As we said, most people develop agoraphobia after they've started having panic attacks.
So the agoraphobia is kind of a reaction to the panic, avoiding places where an attack might happen.
Exactly. It becomes a fear of the panic attack itself happening in certain situations. Fear of the fear.
But what about the rarer cases where there's no history of panic attacks? Primary agoraphobia.
Right, that's less common. Historically, people even questioned if it was a distinct thing. But now, the diagnostic manuals, like the DSM-5, see them as separate issues that can happen together but don't have to.
So they decoupled them.
Yes. And in those primary cases, sometimes traumatic experiences like being bullied or abused might be involved.
And ruling other things out must be important too, things that look similar.
Absolutely. Differential diagnosis is key. Need to make sure it's not, say, separation anxiety disorder or PTSD or major depression causing the avoidance, as symptoms can overlap.
Okay, so treatment. What helps people dealing with this?
The main approach, according to our sources, is cognitive behavioral therapy, CBT.
And it seems quite effective.
Yeah, the data suggests about half of people see real improvement, resolution even, with CBT.
And CBT isn't just one thing, right? It includes specific techniques, like exposure therapy.
Correct. A key part is often systematic desensitization or in vivo exposure.
Which means?
Gradually facing the feared situations. Starting small, maybe just imagining it, then maybe going for a short time, building up. In vivo means doing it in real life.
Gently pushing the boundaries.
Exactly, until the anxiety starts to decrease naturally in that situation. And studies show this real-world exposure is really effective, with lasting results. Having someone supportive along can help too.
Makes sense. And it's not just about doing it, it's about the thoughts too.
Yes, that's the cognitive part of CBT, cognitive restructuring, helping people identify those, catastrophic thoughts.
Like if I go in there, I'll definitely panic and lose control.
Right. Identifying those thoughts, challenging them, and replacing them with more balanced, realistic ones. Learning to reframe the situation.
And learning ways to cope in the moment.
Like
relaxation.
Definitely. Relaxation techniques are taught as skills to manage that rising anxiety, maybe head off a full panic attack.
What about newer methods? Technology.
Yeah, therapy via video conferencing VCP is becoming more common. Great for people who struggle to leave home for appointments.
Accessibility is key.
And virtual reality therapy is emerging too. Using VR headsets to simulate feared environments in a safe, controlled way with a therapist guiding you.
Interesting. Does medication fit in?
It often does. Antidepressants, especially SSRIs, are commonly used because they can reduce anxiety. Sometimes other meds like benzodiazepines short-term, or older types like MAOIs or tricyclics.
But usually alongside therapy.
Yes, the sources emphasize that. Medication seems most helpful when combined with therapy like CBT. That combination often gives the best results.
Okay. What about EMDR? Eye movement desensitization and reprocessing.
The results for agoraphobia specifically seem mixed, generally not as strong as CBT. It might be considered if CBT hasn't worked, or maybe if the agoraphobia clearly started after a specific trauma.
Got it. And beyond formal therapy.
Yeah.
Support groups.
Hugely valuable. Self-help materials, support groups, especially online or phone groups for those who are housebound, sharing experiences, strategies. It combats the isolation.
Building community.
Yeah. And the sources also mention things like regular aerobic exercise potentially having a calming effect. Plus, advice to avoid things that can worsen anxiety, caffeine, illicit drugs, some cold meds even.
Okay, let's touch on the prevalence again and some notable people. We mentioned women being affected more, the typical onset ages, and that interesting note about possibly higher occurrence in people with above average intelligence.
Right. And zooming out again, panic disorder, whether it includes agoraphobia or not, affects about 5.1% of Americans. That's quite a few people.
And of those with panic disorder, maybe a third also have agoraphobia.
Roughly, yes.
Yeah.
But it really underscores how much rarer primary agoraphobia, the type without prior panic, is. Like, maybe only 0.17% of all agoraphobia cases. Very small fraction.
And knowing famous people have dealt with it,
Yeah.
it can be, I don't know, normalizing.
I think so. It shows it can affect anyone. The list in our sources includes people like Woody Allen, the director and actor,
Kim Basinger, the actress,
Earl Campbell, the football player, Macaulay Culkin,
Paula Deen, the chef, H.L. Gold, sci-fi editor,
Daryl Hannah, the actress, Miranda Hart, the comedian, Howard Hughes, famously reclusive later in life,
Olivia Hussey, actress, Shirley Jackson, the writer,
Elfriede Jelinek, Nobel laureate in literature, Mike Patton, the musician,
Felicity Priss, journalist and novelist, Peter Robinson, musician.
and icons like Barbara Streisand, Ben Weasel from Screeching Weasel, Brian Wilson from the Beach Boys.
It's quite a list. Really shows it cuts across all walks of life.
Absolutely.
So, wrapping this up, it's clear agoraphobia is, well, it's way more than just being scared of open spaces.
Definitely. We've covered the range of triggers, the symptoms, those really intense panic attacks potentially,
The avoidance that can take over someone's life.
and the interplay of factors, biological, psychological, environmental.
But also, the good news is there's hope. Treatments like CBT, sometimes with medication, really can make a difference.
A big difference, helping people regain their lives.
And remembering that core feeling, it's about feeling trapped, unsafe, like there's no escape when the anxiety hits. That's the heart of it, isn't it?
That really seems to be the crucial element.
So here's something to think about. We talked about all these theories, evolutionary roots, the impact of modern life, our changing spaces. How do you think our world, as it keeps changing, might continue to shape how we understand and even experience conditions like agoraphobia going forward?
That's a deep question. It really makes you consider that ongoing dance between our internal world and the external environments we build and live in.
Definitely something to ponder. And just a reminder, if you want to learn more or need support, there are resources out there.